Hi, I'm Hillary Moole, Women's Health Nurse Practitioner and Medical Provider with Allure Health and Med Spa. We are starting our Spotlight series where we want to discuss and educate patients on the many services that we offer here. And we are going to start by talking about bioidentical hormone therapy and some very brief information about that. We often find patients are very surprised about the symptoms that are associated with hormone decline. And by the time women reach age 50, we're typically functioning at about 10% of what we were in our 20s and 30s. And this can happen for a variety of reasons, from medications that we take to environmental exposures to the natural decline of our bodies as we age. The hard part is that when our hormones decline, a lot of times we're told that this is just normal, that it's part of what we have to deal with as we age. And a lot of the symptoms that we experience are not normal, and we don't feel like ourselves, so it's hard to accept that this has to be normal for the rest of our lives. And a lot of those symptoms lead every single patient to walk in our door, and we know that menopause, which happens around age 50, can contribute to symptoms like vaginal dryness, hot flashes, night sweats, bladder changes. But there are a lot of variety of symptoms that can also be associated to hormone decline, including things like mood fluctuations, not feeling productive with the focus and concentration that you have at work, issues with sleep, not being able to fall asleep or stay asleep, frequency and changes in how you experience headaches. We also see changes in how our skin looks, in both wrinkling and the dryness that you feel, along with your hair becoming thinner, more brittle. We can see increases in joint pain related to higher levels of inflammation in the body. So a lot of what we contribute to normal symptoms of aging don't have to be normal as we go through the stages of life and as our hormones decline. We have a lot of options. When we go to traditional medical providers and they say, we want to look at blood sugar levels, we want to check for diabetes, we want to look at your thyroid levels. If any of those things come back abnormal, what does traditional medicine do? We work to put those levels back into the normal range. So it's hard for me to accept that sex hormones, which really should be called brain hormones, skin hormones, muscle hormones, sleep hormones, and on, are acceptable to not be in the normal or even optimal ranges. So if your thyroid levels come back low, what do? We take a medication or a supplement to put those levels back up into the normal range. When your insulin levels are not where they should be, or if we are pre-diabetic, we work to make those hormones normal. So with estrogen, progesterone, testosterone, we are working to make these things normal again, and we can rectify the symptoms that go along with hormone decline with bioidentical hormone therapy that's individualized to you. And we have a variety of treatment plans that we customize to patients, and all that starts with coming in and sitting down with me and having a consultation where we go through medical history and discuss those symptoms.